At a time of increasing uncertainty in the world, many of us are realizing that things that in the past we've taken for granted may not be with us into the future. People of my generation believed that it didn't really matter how we conducted our lives as a species on the planet, for example. Good old Mother Earth would be okay. Nature always found a way of adapting and sorting things out, but not so. And here in Scotland, as in many other places, access to healthcare is regarded as a right, and that the welfare state is always going to be there to pick up the pieces if things go wrong. Equally, we're discovering that's not true either. So why have we got it so wrong? How can we, through both individual and collective action, create a better future, a future we choose for ourselves, our families, and for others? But before we can do that, I think we need to better understand the reality of where we are now. My world, as you just heard, is the provision of healthcare. I also do a lot in innovation and the use of digital technologies. So if you don't mind me the indulgence, I'm going to approach it from that direction. I want to suggest to you that the model of healthcare delivery that we've all grown up with, it's not fit for the 21st century. The medical model of care, that paternalistic or maternalistic provision, while feeling on the one hand comfortable, you can go to your doctor or nurse with a problem, we take it from you, we sort it out, then we throw it back, seems on the face of it to be ideal, but really is it? What it does is it creates dependence. It can disempower rather than empower. It forces you to conform to be able to access services on our own terms within the NHS, a situation that many, particularly the most vulnerable or disadvantaged in our societies, find it difficult or impossible to do so for many reasons not of their own making. And then we blame them when they can't access services that we deliver for them. The percentage of a nation's GDP being consumed through the provision of healthcare is increasing almost exponentially year on year, whether you're in the global north or in fact in the global south. So the current way of doing things, I would put it to you, is not really sustainable. Add to that the challenges of aging populations, the associated burdens of disease and frailty means we need to do some things now, some things different. And then, of course, there's climate change. The effect of climate change is likely to create an even greater public health crisis than that experienced by us over the last couple of years through the global pandemic. So should we be downhearted? Should we just give it all up? It's too difficult for us. I don't think so. There are things we can do because, for example, healthcare is not an insignificant contributor to carbon dioxide production. In fact, if global healthcare provision was a country, it would be the 5th highest emitter in the world. The supply chain and travel are regarded as the greatest contributors to that. And wherever healthcare is being provided in the world, we're beginning to reset those dials because we recognize we in the healthcare community have a part to play. So that got me thinking. What if we used lessons learned and opportunities created from other parts of my professional life, the innovation and the development of next generation digital tools and services? Could we use those learned experiences to make a positive difference? If we plan now, we could develop an ethical way of harnessing these tools and technologies for common good. Some global technology providers and others have learned over many years the value of data. The more that these organizations know about you and I as individuals, the more they can personalize services for you. The easier they can make it for you to access the services they offer, or should I say, sell to you. Like the old medical model of care, they can create dependence, keep you loyal and happy, and through that, they can maximize their income. Now, I'm not for 1 minute suggesting that's wrong. We just need to be aware of it. For example, did you know that you and your next door neighbor tonight, as you sit in your front room after this session, watching the same program on satellite or cable television, the adverts that you're going to see at the breaks during that program will be different for them than you, because the providers know what your interests are and they're beginning to tailor make adverts that are targeted specifically at you. Now, some of you will be aware of that. There'll be others listening to me just now going, really? That is today's reality. But what have we learned from this? What if we stop designing health and care services around the needs of organizations or those charged with delivering that care? And we truly invested in user-centered design. What if we invested in our citizens, giving them digital tools that would allow them to curate their own data, make better informed health and well-being choices, and allow them to access services on their own terms, and empowered them to deliver more of their own health and care services themselves, supported by family and community? If we better connected people to communities, we could improve community resilience. And by understanding our lived experience, we can better personalize health and care services, drive up quality, drive up safety and effectiveness. We know that if you take away a person's sense of being in control of their own life, you can cause harm, both psychological and physical. We also know that enabling and empowering people can promote a sense of worth and well-being. So we can achieve this goal not by spending more on the direct provision of healthcare, but build resilient community assets and resilience within our communities. So as we look to our built environment, how our cities and our towns function, how we strive towards a net zero goal, let's make sure we invest once and use that investment many times so that we can deliver profound improvements in well-being. So the future I choose is one where we stop planning in silos, stop investing in silos. We focus on user-centered design. We listen to what's important to you and me as citizens and act on it, and invest smarter in our cities and our communities. That's a successful future from my perspective.